10 seconds now. Live in 3, 2, 1.
Welcome to the heart of innovation. 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global P.A.D. Association at padhealth.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global P.A.D. Association, Kym McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness,
Dr. John
Dr.
Phillips.
John
Yes.
Phillips.
Ooh.
Welcome to the show. Today is such a special day because we are celebrating the start of year 3 for the Heart of Innovation and my partnership with Dr. John Phillips. You know, we started this incredible journey in 2022 to raise awareness for cardiovascular and vascular diseases, especially peripheral artery disease. You hear us talk about it a lot, which is restricted blood flow in mainly the leg arteries. We couldn't have done it so far without the amazing support Cardiovascular Systems Incorporated, which merged with Abbott last year, and our amazing champion there, Jim Wilson, who supported us our very first 2 years. Going into year 3, oh my goodness, I thought it would come to an end, but an amazing group of humans dedicated to helping patients with the most advanced stage of peripheral artery disease, known as critical limb ischemia or critical limb threatening ischemia, stepped up in a very big way to carry us forward. And in just a few moments, you are going to hear who they are, in case you didn't catch it in the opening of the show. And we're also going to hear about their groundbreaking technology that they're manufacturing to help save life and limb. Now, I'll also tell you about, during this show, my visit to their manufacturing facility this week, where I got to meet the passionate, very passionate limb-saving engineers and their teams and see how their technology is actually made, which I know this for sure, it made Dr. Phillips jealous. I saw many of his peers on their wall of visitors, from Dr. Peter Sukas from Maine to Dr. Kevin Herman from New Jersey, even Dr. Jay Matthews, who our patients call Dr. Miracle. He's in Florida. But John, you know what? I hear that you are next. So a trip to Southern California is in your near future, I think. What do you think?
Kym, that'd be pretty sweet. Happy Saturday. I'm looking forward to kicking off this partnership with Reflow Medical. I've worked with them for quite a while. They not only do great things, but I think they are very much patient-centered and focused, which is paramount when you take on this task of treating people with peripheral arterial disease and critical limb ischemia. So I definitely need to get out there. I'm looking forward to helping them with some training and things of that nature. So yeah, it's a great partnership. Really appreciate their stepping up to help us out, because obviously you feel very passionate about this. I feel very passionate about this, but we can't do it without sponsor support. Because, I initially thought there was money to be made in doing radio and podcasts, but unless if you're the Kelsey brothers, really not, huh?
Exactly. And it's
Are we?
we could sell, in a sense, the commercial spots in our show, to allow for other companies to come in and do commercials. But the reason that I am in partnership with KDOW is because I like the fact that we do have more control. Yes, they have a certain set of spots that they can actually sell to keep their lights on and to keep the electricity flowing and the airwaves going for us to be broadcast on. But they also allow us to have some commercial spots as well. And we decided that we would rather use those educational spots for opportunities, or the commercial spots, I gave that away, for educational opportunities. And you'll see, as part of this new series, that we have multiple education spots. Our big goal in this is to really raise awareness for cardiovascular and vascular diseases, particularly, one that is more prevalent and deadlier than most cancers combined, and yet is one of the most underdiagnosed, most prevalent diseases that so many have never heard of. They did a poll recently And they found that more than 70% of Americans don't know the term peripheral artery disease. They don't even know what it is. And we talk about it all the time here, which is the restricted blood flow in the legs. And what people don't know is that, so many people are getting their symptoms brushed off as neuropathy. I had a gentleman call me yesterday, John, and he was saying, yeah, I just got diagnosed with peripheral artery disease last week, but, I know I have peripheral neuropathy, so I'm not sure how much my pain is going to get better by doing your walking program. And I said, I'm sure, you're here. Obviously, you have narrowing your arteries. I would imagine a good amount of that neuropathy is due to poor circulation. And that is the number 2 on our list. Number 1 on our list in terms of misdiagnosis in our group in particular is back problems, sciatica. And while you may have back problems in sciatica, it might not be the reason or the main reason that you are experiencing pain, especially while you're walking. So number 1 is back and sciatica pain. That's the number 1 misdiagnosis for peripheral artery disease. And number 2 is really that diabetic neuropathy or neuropathy. Some brush it off as old age. They say you're old, you might have arthritis, you might have fibromyalgia, but it's really P.A.D. And so a lot of our segments, the first commercial is describing what is peripheral artery disease. You're going to hear that in every single show. Colin, our producer, just voiced that commercial for us, which I think you'll hear coming up. I'm really excited about and very thankful that he voiced that commercial for us.
He has
You
a very
also
good.
did one.
He's got that voice too. He's got a voice too. I like that. Right.
We love it. And I've been waiting for another opportunity to use it. And now we have it. And John, you also did our other educational spot. And this is the very first one that we have for doctors. And it's called The Pulse. If you want to describe what that one's all about.
So yeah, that's kind of just a 60-second little snippet about a case that a particular physician did. This was mine, and really it was kind of a learning opportunity. So I kind of share. We'd call it a vignette. We talk a little bit about the patient's history, why they're coming for procedure, the procedure itself, and then in this case, I shared a complication that wasn't catastrophic, but it definitely changed the course of that patient's treatment plan. So hopefully we can, with this new season, we can have more physicians listening in and sharing their case. I know I have several of my partners that are interested in doing that as well. But Kym, do you know what else I have? I know we only have a minute to break. I am sitting here with my nurse practitioner, Brittany, who is working. She works hand in hand with us in the hospital. And hopefully in the next segment, she can share a story that we were able to, I think, hopefully help save a limb today with a patient using hyperbaric treatment that we typically don't do on the weekend. So really looking forward to sharing Brittany, or talking with Brittany, and then sharing that story.
That will be coming up next. And one of the commercial breaks that we have coming up as well is an educational segment additionally for patients, because walking's the best medicine. And so every single week, a segment that John actually named is called Go with the Flow. So you'll be hearing the very first episode of that coming up later on in the broadcast during our commercial break as well. So hopefully commercial breaks will be just as educational as our regular show as well. We'll see you in just a moment, everybody. So stay with us right here on KDOW. We'll be back with Brittany.
Leg health can indicate risk for heart attack, stroke, and amputation.
So,
if you have leg pain or leg cramps while walking, get checked for peripheral artery disease, or P.A.D. P.A.D. is a buildup mainly in the leg arteries. Be sure to ask your physician for an ankle brachial index, also called an ABI test, where they use blood pressure cuffs to analyze the blood pressure in
Brittany,
your legs.
thank you.
If they discover you have arterial plaque that is
Yay, so I'm going
blood
to
flow
let
to your
John
feet,
just go ahead and
medicine and a regimented
jump
walking
in
program are frontline treatment.
I'm excited. I
If
appreciate
PAD
you
is in
jumping in here.
yes, it's very impromptu, which is what we like. So
Brittany,
Brittany Kym is my co-host. She is basically started what used to be you've seen some of these, the Heart of Innovation, but now what is the Global P.A.D. Association, really an advocacy platform for patients with P.A.D. And I'd love for Brittany just to kind of share her experience as a nurse practitioner working with us, but also share the story about a particular patient today that hopefully we haven't saved her. We weren't able to save her piggies, but hopefully we can save her leg. So, and Brittany has a wealth of experience. She's been with us 10 years now, almost 10. And she certainly is capable of sharing said story on the air live.
I think this will be really, really fun. I'm really excited about it. This will be cool.
Plus, if I get called in because I'm on call, or she can cover for me for a few minutes.
That would be awesome. So, Brittany, it might be you and I co-hosting later on in the show.
Let's do it. Let's do it.
All right, folks, we got about 15 seconds till we air.
Are we doing the moment of inspiration?
Oh, you want to do? I'll let you open up. Can you do inspiration right out?
Yes, I can.
You're the best.
I got rid of my gum.
Good call.
Sorry, not used to being on the air.
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Dr. John Phillips, spectacular, vascular moment of inspiration.
So Brittany's probably, I don't know, she's probably never heard that, or maybe she has. But so today's moment of inspiration, I was thinking about what happened August 31st throughout, the span of time. And today in 1997, Princess Di was killed in that car accident. And I know she was very much a humanitarian and I think loved helping people. So I was looking for an inspirational quote from her. And I found one that I think dovetails into what we try to do, Brittany tries to do, all of our team tries to do, you try to do on a daily basis. But, sometimes we lose sight of that, the forest for the trees things, when you get consumed with other external forces that we have in the hospital, et cetera. And so I like this quote, and it's pretty simple, but I think it's poignant. So Princess Di is quoted as saying, "Anywhere I see suffering, that is where I want to be, doing what I can." And, you're out there doing what you can, Kym, as is Douglas and the rest of the crew. We're here in the hospital doing what we can to ease suffering. And I think that's probably one of the top things you should think about as a physician or a nurse practitioner or anybody taking care of people. Your number one goal is to ease their intermittent suffering, or their immediate suffering, I should say. And the rest of it kind of falls into place. So anyway, I thought that was an interesting quote. Unfortunately, she died now, 1997, so quite a few years ago. But I think that quote still rings true today.
And I find it's exactly right that the number one thing to help ease suffering is love. It's knowing someone actually cares. Feeling heard. And the moment that you as a doctor, or Brittany, you as a clinician, the moment that you have an interaction with the patient and you just look them in the eyes and you say, "I hear you. I feel you. And I'm gonna do everything in my," that means the world to them. That little glimpse of hope, that little feeling of love can go such a long way. So it's amazing. I just honor you guys for what you do, and especially how you do it. And I hear that you have a story of a patient right now that, yes, they did have to lose their piggies, but throughout the process, you're able to really be with that patient and give them so much love and care every step of the way in order to help them heal and get as much back on their feet as they can and live a better quality of life. You want to go ahead and share some of that story?
So I'll just say that, Brittany, as you listen to this show, you'll realize a couple of things. Number one, Kym has a much better personality, radio, voice, face for TV, et cetera, than I do. And she's fantastic at asking questions and having open-ended questions and bringing in segues. So share the story with us if you don't mind, but just give us like a little bit about your background and why you do what you do, and then why you kind of went the extra mile today, which is what you clearly did.
Sure. So I've been with this group. This has been my only nurse practitioner gig since I graduated in 2016, and I started here actually before I even passed my boards. Never really had an understanding or passion for vascular until I met these physicians in the team here at Riverside. They all took me under their wing, trained and taught, and I observed, obviously, through experience and patients alike, how to identify vascular disease, and then more importantly, how to have that bedside manner. I've modeled my interactions with patients based off of Dr. Phillips and his partners and how they educate and interact, and that's kind of what I've done throughout my career. Speaking more specifically about today's scenario, this patient has a long-standing history of both vascular disease and pretty significant kidney dysfunction. And with those two things together, it creates this perfect storm, as you all know, for calcific areas of disease in the lower leg. And so she's had quite a go at it over the last 7 to 8 months. Her daughter actually is also a nurse practitioner. She works here, I believe, or somewhere. She used to work here. So there's an understanding within the family of these complex medical issues, and her daughter is a really good advocate for her. But we first were introduced to her back in January when she had some small ulcers on her toes that we treated conservatively for a while. They continued to progress in spite of our best efforts. And then Dr. Phillips revascularized in a very complex manner one of her below the knee arteries just about a month or so ago. And then unfortunately, she had suffered some other cardiac complications that laid her up in the hospital, and ulcers progressed again. And ultimately, she required some digital amputations that quickly failed, as in a matter of, I think, like 4 days ago. She had some digital amputations, and then those quickly became ischemic. We offered hyperbaric oxygen therapy, which not a lot of people know about. And it's one of my personal passions since joining this team. It's a really nice adjunct to have on a vascular service line like this, where we work closely with our podiatrists, who often are the bulk of our referral base, for patients that meet the criteria for hyperbarics. And one of the probably most beneficial indications for it is what we call ischemic flap failure, which is exactly what this lady suffered from a couple days ago. And so we urgently did one treatment just to see if we could try to hyperoxygenate that tissue and reverse the damage. But unfortunately, it was too far gone, and she did require the transmetatarsal amputation, which she had yesterday.
And the transmetatarsal amputation is getting rid of all the toes.
All 5 toes. I apologize. Yes, all 5 toes. That leaves a functional foot most often, but yes, all 5 toes are gone, and that was just because of the level of ischemia or loss of blood flow to the tissue. So we thought that that would be probably the most definitive amputation while being able to preserve the most tissue and again, a functional foot. So this morning, we all went to go see the patient together alongside of the podiatrist who performed the surgery yesterday afternoon. And we were there for the original dressing change. And the original dressing change after surgery is always the most poignant, because really we can tell the foot will declare itself in that moment. We'll know, is this going to be a viable incision line? Is this, foot going to progress to healing, hopefully? Or are we going to go the other way? It's usually pretty telling in those first 24 hours. And as soon as she removed the dressing, it was unfortunate, but the flap itself, again, that is incision line is what I refer to as the flap, was pretty ischemic. So on the weekends, we typically don't offer hyperbaric oxygen therapy. It's usually a Monday through Friday outpatient procedure, low risk, but outpatient. Patients drive themselves here and then have the treatment, which is about an hour and a half, and then drive home.
I'm going to interrupt. Just can you describe the hyperbaric chamber for those that may not be familiar with it?
Absolutely. So my only experience with hyperbarics prior to coming to this job was Michael Jackson. So a majority of the lay public probably has heard of hyperbaric oxygen therapy because a lot of celebrities and athletes use it for non-FDA regulated, but some studied indications, like for sleep, the fountain of youth, because it's, in essence, you're just breathing pressurized 100% medical grade oxygen. So that's the treatment itself. You're in a contained enclosure. It's plexiglass lined, almost like a cylindrical tube. And you just lay in a bed and you just breathe this pressurized oxygen. And it sounds very simple, and in essence it is. But what takes place at the cellular level is this kind of vast cascade of different types of, I don't know, old high school stuff like Boyle's Law and Charles' Law and Henry's Law, things that occur at the cellular level to actually recreate blood vessels, so angioneogenesis, heal infected bones, so people that have, osteomyelitis of their bone, And just, again, the tension from the pressure can help pull wound edges together. So hyperbaric oxygen therapy has a very specific set of approved indications that the FDA recognizes. And then it has those kind of off-label things like Michael Jackson was using it for, like sleep and, healthy skin, and again, other kind of not off-label things. So that's the treatment itself. You lay in a chamber, enclosed, breathe oxygen under pressure. So
it's like going scuba diving.
It is. We actually refer to patients as divers because the science behind it is identical to scuba diving science. So we actually use the Navy dive tables when we're learning about hyperbaric oxygen therapy. And through that table, we're able to determine how long a patient can remain at depth. We actually bring them down to about 60 feet below sea level, and we hold them there at that pressure, breathing 100% oxygen for about 75 minutes. And during that treatment time, all those complex things can occur.
And so I want to stop you there because coming up right here on the Heart of Innovation, you're going to find out, now that you know what a hyperbaric chamber is and how it works and the mechanism of action, we're going to find out how they're using it for this particular patient. That's right here on KDOW. Don't go away.
Three years ago, my symptoms.
Shit, I love this show.
I was gonna say you may have found a new co-host. I'm like, I'll just fade away. She's doing great.
I'm not. You're not. That's not a joke. Literally, yeah, you're so much fun. You're so good. No, she is so freaking knowledgeable. I think, yeah. Even Marcia says that's excellent. We have a live studio audience of people with P.A.D. here. John, that would be great if Brittany is not opposed to it. When you're not there, coordinate with her.
Sure, if she's up for it.
I said he's got to get me some merch.
Thanks, Brittany.
We need to get her a collared one with it on there. They're on our website, the shopping one. She can get a collared one with the Save My Piggies.
Oh yeah. Well, I mean, look at this. Like, I've been kicked off already. Cancel. I guess I wouldn't say I'm canceled because I haven't done anything stupid, but I just moved on.
So what do you think? So we have this next segment, and then we need to actually spend a segment on Reflow and their technology.
Sure. Yeah, because I think, because we can. That's fantastic. No, you're good. So we have. We have how many? 8 minute or so.
Yeah, this is like an 8 to 10. I think it's now about 8 minutes with all of our commercial breaks. Now I think we're
okay.
Less. So I think this is 8. And so we'll still spend it because I think that there's still so much to discuss around with Brittany and you and this patient and the learnings and stuff. And then the fourth segment will go into Reflow, and the final segment we'll talk about P.A.D Awareness Month.
Right. So just to give you guys a heads up with the next segment coming up, so this is Dr. John's The Pulse one, and on my side I have it as 3 minutes and change, so you're actually going to be talking closer to like 7 minutes for it.
Segment?
Yeah, for this third segment coming up here. Also, we have about 1 minute and 15 before we come back in.
Okay. Do you like these segments, Colin?
Say it one more time.
Do you like these segments? Do they work really well in there?
I mean, for the most part, I think they work. They just remind me of when you had your medical notepad and then sometimes you would have your doctor ads on. I thought they were the extension of that.
Mm-hmm.
Yeah, so we, let's continue the conversation about hyperbarics because not a lot of people really know about it. And also I think it's important to the time commitment because, and the number of dives and the fact that there are some, I think, medical professionals that don't really believe in it and feel that it's beneficial.
Yeah, we can talk about that too. Just tell me.
When it is the number one, and that's why I want to get, I have patients that come to me and ask me about it, and then I have to go to the vascular, and then the vascular goes to the podiatrist, and then they order it. But why does it have to be that complete dance around? Why do we have to go through?
All right, folks, I hate to interrupt. We got 10 seconds till we're live.
I'll bring us back.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. I used to be the co-host of this show, but since I invited my nurse practitioner, Brittany, here, I think she's won a lot of hearts over. So you know what? I may be shuffled off this wonderful little seat. No, I'm just kidding. We are going to continue our conversation with about hyperbaric treatment because it's important to talk about this patient, but I think it's also just important to talk about the whole process itself because not a lot of people know about it. Not a lot of medical professionals may agree that it works. So, Brittany, tell us a little bit about actually what your plan is for this patient and how many times have we dove somebody on a weekend and a holiday weekend? So what that means, like getting all these people together and then just kind of hyperbarics in general and some of the indications, if you don't mind.
Sure. So just to finish up what we outpatient low risk procedure that we only offer Monday through Friday here, there are very few urgent or emergent indications for it. However, because her flap showed such early signs of ischemia and she has, in essence, no real revascularization options left for her blood flow, her disease is all small vessel, hyperbarics is really the only thing we can offer her. So all the studies that have been done, which in hyperbarics in general and broadly, they're usually low sample size studies. So that's why the data is kind of misconstrued and not well understood by other medical professionals, which I can get into in a moment. But for her indication, ischemic flap failure is one that we don't even need to apply for insurance approval prior to even diving. We can literally say the flap is failing, get her into the tank. And that includes flaps from, let's say you were in a car accident and you had to have a reconstructive flap put on your shoulder because your shoulder muscle got torn off. If that flap fails, hyperbarics is absolutely indicated in that setting to try to preserve that tissue. So same kind of hypooxygenation, and hyperbarics offers hyperoxygenation. So we put her in the tank today, and this is kind of unprecedented for us. I mean, we are a very large hospital system, but we do not dive people on the weekend. So there's been only one other occasion that I've been here for a while, 10 of the 12 years that the program has been around. And there's been only one other occasion where we dove somebody urgently on the weekend. So this required massive coordinating between our medical director, the management team up on the unit where we dive people, and then multiple layers of leadership. So it was a really, really nice thing, a collaborative effort, all for the sake of limb salvage for this patient. And her limb, the outcome is still guarded. But if we can at least
just this morning. So you had to do on a holiday weekend. You had to be dialing people's cell phone numbers and home numbers to say, hey, we've got an emergent situation here. And I think clinically, this is the best bet, or else by Monday, we might be chopping off her whole leg.
That's exactly right. And people jumped to, within a matter of minutes after the text went out, we had two, not even just one hyperbaric, we call them tenders or nurses. We had two for each day because we like to have a backup. So 6 nurses coming in on the holiday weekend, just to help this lady. And they're all, they know her as well because she's a wound care patient. So these nurses are familiar with this patient. It was just a really heartwarming, and it was the right thing to do for her. And so we're hopeful that this, in combination with everything else that she's receiving.
And I think this is just a great story to celebrate something positive and illuminating in an often dark world that we kind of practice in. We spend a lot of time second guessing ourselves, pointing fingers, complaining about this, that, and the other. But when, again, the quote about easing suffering, to do something like this, and Brittany took this on herself. I mean, honestly, we used to be involved a little bit in hyperbarics, but I don't have my finger on that pulse at all. And so she took this on, and the team also embraced it and said, okay, let's do this. This is the right thing to do. Not for once, but this is about patient care. And this is kind of why we do what we do. And that's why I'm so proud to be a part of it. And I'm glad she can share the story with us.
I mean, I'm sure, Brittany, that it's not often that you have a situation like this where you're like, hey, I need a huge favor. I need all hands on deck. And you're not one to cry wolf. If there's a critical need, they're going to jump at it because you would also do the same for them.
Exactly. And I think that, oftentimes when, like Dr. Phillips was saying, we are often sharing bad news with patients. We're telling them there's nothing else we can offer you. You have cancer. You're going to lose your leg. If there's that opportunity and it comes up, like you said, rarely, where we have to jump on it and emergently offer something, and we can, and it requires a little bit of stretch and a little bit of bend. But if you have people that buy in and are passionate about patient care, then you can really accomplish anything. And it was so just in these times, it was so uplifting today for all parties involved.
No, I think that's amazing, because even this week I had situations where I was actually told that a patient couldn't have a procedure because this emergency room doctor did not feel like calling the vascular surgeon at home, and literally wanted to just leave them there overnight. And by morning, that, the necrotic tissue, it's just going to keep getting worse, and they're going to need the amputation. I mean, and to hear that you guys are going the extra mile and doing this, I hope it inspires others. It's not like we want to expect everyone needs to have a life. You need time with your own families. You need time to just rest and revive yourselves. But here's a situation where, you're like, okay, here's a group that can rest and revive, but here's a group that is already rested, revived, and so passionate about patients and are willing to go the extra mile now that they have the opportunity. And I think that that's great. And coming up right here on the Heart of Innovation, I know we keep putting off what we were planning to talk about, because we got this amazing blessed surprise with Brittany being here, and the story of this patient and how their team has just rallied over a holiday weekend to help save this patient's leg. So I want to continue with this, if you don't mind, a few more minutes. And we're going to continue the story, see where the patient's at now. And I know we have a question that is coming in from our studioed audience that we want to get to about hyperbaric chambers. So stay with us right here on KDOW. Don't go away.
The Pulse, brought to you by Reflow Medical, the pulse of medical ingenuity.
Here's Dr. Phillips.
Organization, the Global P.A.D. Association, featuring physicians sharing their learnings from complex treatments for coronary and peripheral artery disease.
This is Dr. John Phillips with this week's case. I think the part of what we do is learning from I wouldn't say our mistakes, but just kind of misadventures sometimes. And a few weeks ago, I was taking care of a gentleman who had a limb-threatening ischemia, meaning he was out on deck for a major amputation. He'd been turned down several other places, and he had blocked artery behind the knee.
What do we want to talk about?
And oftentimes we have to put a tube in, kind of facing down towards directly in the affected limb. And with that tube, we can advance wires and little tiny catheters to try to open up that vessel. Oftentimes that doesn't work, and then we have to put a tube in the foot and kind of connect the dots from above and below.
We should probably just talk about how difficult
but in doing so, there was so much calcium,
commitment that
the arteries
have to do hyperbarics, and the commitment from their family too.
Sure.
That's part of the issue.
Do you mind, Marcia jumps in? I think Douglas wants to just say a quick little thing. He put a little note in there. He wanted to say just a quick, if you can, call in Douglas just really quick. He just had a quick thing he wanted to say, right, Douglas? I see what you wrote. Do you want to just say that live? Okay. And then Marcia, wherever Marcia went. Marcia, we can call on you. Just go ahead and unmute when he calls on you to ask your question. That's a good question. Okay. And if Nancy has one, we can call on her too, but I don't know. She's not raising her hand.
Remember we had, so another thing that's going on now is Burning Man, which, remember we had that guest on from Burning Man, or he went to Burning Man.
Everyone drives from Silicon Valley over there. It's amazing what they have to get into. I wish we had someone that could go live with us from Burning Man. Maybe next year.
Like, it seems pretty crazy to me, I guess, from what I've read.
Oh, it's completely wild. You should see how my friends, I've been a part of preparation. I just won't go. I'm literally, because of my asthma, I can't be around that dust at all. Like, that would be just deadly for me. So I don't even want a chance. Because having the mask on, right? So they were like, oh, just wear a mask. And I'm like, I can't wear a mask for that many hours. And then conversely, I can't be out in the dust. So,
yeah,
I help people prepare.
Yeah, I mean, it's kind of crazy though, because you read a lot of stuff about it, and I just read actually that they now have a makeshift airport for like the billionaires that fly their flights or that fly in, and they have
Well, they do.
Yeah.
Yeah, they've had that forever.
Mm.
It's just gotten a little bit more formalized, but they have private planes. The guy that saved my mom's life, and flew my mom emergency, does that. He actually, or has done that, where he would fly in small groups into Burning Man.
Oh, wow.
Which is crazy. And last year it flooded.
Isn't it in a desert?
Yeah, wasn't it? I thought it flooded though. I thought that like it got this torrential rain or something.
Jeez, that must be disgusting. He's like, I've seen pictures of people wearing very little clothing and full of paint, and that seems like a mess, frankly.
Did you? I don't think you could see it here. But I created all new
Oh yeah.
graphics and everything for it. But I need and maybe this is something Brittany can help me with. John, I got to get a different picture.
Yeah. I mean, you don't want the one from when I just started here 12 years ago.
It's not the same like technology anymore. You know, it's not as much your youth. I think you still look the same, but it's just that it's grainy compared to the new HD cameras. And so I just need you in a few different. I need a few different, like I need you in front of a green screen. Like I need
Hey there, folks. Sorry to interrupt. Just want to give a little bit of information. Roughly going to be about 15 seconds till we air. The flow segment we have in this segment is about 2 minutes, 30 seconds. So we only actually have about 8.5 to 9 minutes of talking for right now. We're going to be coming live in about 5 seconds now.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thank you for joining us. Brittany's been such a hit. We've got several questions from the studio audience. And Douglas, what's on your mind, my friend?
Well, we talk about hope, courage, and strength in this program a lot. And as a patient, listening to what y'all said and what y'all go through when you took your oath, it's absolutely amazing. And the hope and courage to hear in your voice, Brittany, and you too, Dr. John, about what y'all go through and what y'all give to us. There's no words we can say thank you enough for what y'all do and how y'all give. And all of us out here wish we had doctors like you on our team.
We appreciate it
very much.
And Douglas, home for you is Texas, right?
Yes.
So we've got folks from all over the country, and sometimes people calling from South Africa and whatnot. So thank you, Douglas. I appreciate that.
Okay, so also we have Marcia. Marcia actually has a question. Thank you so much, Douglas. Marcia, go ahead and unmute and ask your question, Dr. John Phillips and Brittany.
Thank you, Kym, and thank you, Dr. John and Brittany. I found what you were talking about very interesting about the hyperbaric chamber, and I'd always heard of it, but I guess I never knew what it was. So your explanation was very good. My question is, why aren't they used on a regular basis, and why did it take kind of an act of God to use it on the weekend if it's really truly that helpful?
Yeah, please.
So there are a lot of regulatory hoops that we have to jump through every time someone undergoes hyperbaric oxygen therapy. If you get to Googling hyperbaric oxygen therapy, usually the first 6 things that will come up are the catastrophic explosive fires that have occurred as a result of unregulated people manning these facilities. Because remember, it's pressurized oxygen in a contained cylinder delivered under pressure. If you bring anything unregulated into the oxygen pressure chamber that could potentially create a spark. So I'm talking flint and unregulated cotton and some of these things. People they brought a horse into one that had their horseshoe still on, it bucked, and when it bucked, you introduce a spark to oxygen and it just combusts, and that chamber essentially becomes a torpedo, and it would just take this entire building down. So as great and as passionate as we are about offering hyperbaric oxygen therapy and as safe as it is, we go through extensive safety regulations as a team. And then every time a patient dives, again, I keep using that verbiage, that's what we call them, divers. Every time a patient dives, we go through a list of, you cannot have hairspray on, you cannot have deodorant on, you are there with your body that God gave you and the gowns that we provide on the 100% cotton linens that we provide. In addition to all the safety regulations that we check and make sure are very, very thorough, we also are very, very bound by patients' insurance companies, by what the insurance companies will pay for. With no insurance, hyperbaric costs about $3,000 a treatment, and most patients require a minimum of 30 treatments to achieve a benefit from, right? And this is something that we were going to get into, but this is perfect. Your question is perfect because I can talk about it. So hyperbarics, the way it works is in an accumulative effect. So I can't just dive you one time today and one time in 2 weeks. I have to dive you sequentially at minimum 5 days a week, uninterrupted for 30 dives. That's the ideal scenario, because as that oxygen content saturates the tissue that is of concern, through those mechanisms that I described earlier, then and only then can that complex process of formulating new blood vessels and new bone can occur. So we have a lot of, patients that have to buy in. They have to accept that this is a, part-time job in essence. Their families have to transport them if they can't, work a gas pedal, if that's where their wound is on their foot. So the whole team, family included, has to be part of this. So there are, again, these few and far circumstances where urgent hyperbarics is required, today's scenario being one of them. The other one that you may be familiar with is carbon monoxide poisoning. People that have a gas leak in their home and unintentionally breathe in carbon monoxide, an urgent indication to cure that is hyperbaric oxygen therapy. And that is something that can immediately reverse the effects of carbon monoxide poisoning in a matter of 20 minutes, breathing that pressurized oxygen, as opposed to the hours and likely, too late at that point, that it would take your body to clear that with only just breathing ambient oxygen. So there's a lot of science and a lot of behind it.
What a fantastic explanation, huh?
Yeah, lots of information. I love the way this whole show has turned, and we have a new star of the show. She is amazing, and we're gonna have her back.
Get out here.
Over and over again. She's got herself into trouble. So stay right here on the Heart of Innovation. We're going to continue. Don't worry, Brittany's not going away, so you don't go away either. We'll have more with nurse practitioner Brittany and, of course, Dr. John next right here on the Heart of Innovation. Don't go away. Here's one of my favorite shows. So you know what I think we do, John, is,
yes.
And I'm sure Reflow is going to understand, is yes, let's continue, because I think we want to wrap up this conversation with where we're at and the patients, because I don't want to leave people hanging on it. And then in the end, I can say, and even Marcia says a star is born. Yep. So I think in the end, what we do is we say, and gosh, this show took a different turn. This is great. I love it. And then, we talked about doing the tour. Our brand new sponsor again is Reflow Medical. We're really excited to have them, of course. And we're going to talk about, we have Isa, the CEO, coming on Saturday, September 28th. Mm-hmm. So people can tune in, hear about the tour, hear about the technology at that point. What do you think?
That's good. Take us back. Wrap it up. I won't talk anymore.
He's fired.
Yep.
No,
we want you to hang around.
Oh, thank you. Thank you.
I love you.
I love the patronizing tone and the voice.
No,
it's great though. Like this is an organic show, totally off the cuff, but I think people learn a lot. I mean, I'm learning too. Hyperbarics for us it's a lot of work for our nurse practitioners as well, because
you're going to take it back then, because that's exactly what would be great to say. And then can you update us just on the patient, where you're going? And then, because we literally have probably 2 minutes to wrap that up. And then John and I for 2 minutes, just again, addressing that we have the new sponsor. We're really excited. This is the reason we're so excited about these shows, is these moments like this one. And it's really all about the patient. Then when we have opportunities to share patient stories and to, you know, whatever.
Mm-hmm. Yeah.
And don't forget, it's not about, also what I find interesting about this program today was what the doctors actually have to go through sometimes too, to give us what we get from y'all. And we don't think about that a lot. I want what I want when I want it. But I also have to realize you have kids, you have a life, and there's a lot of things you go through.
It's 3:00 Eastern time, typically on the weekends, and we're lucky to have our nurse practitioners helping us in general, but we kind of have a stop of seeing new consults at noon. So they're often gone before noon. So again, sticking around, finishing the job, doing what's right, is important. I mean, and we don't highlight that enough, frankly.
Hey, I hate to interrupt. Roughly, we're going to about have 20 seconds till we come back in. Last section. So for this one, as soon as you hear the music, we only got about roughly 30 seconds to get out before the outro goes. But we have our full time with it. So right now it should be about 10 seconds and then we're going to come back in.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Wrapping up the show here, we only have a few minutes left. I love the fact that we kind of took an organic turn with respect to a topic that is pertinent to what we do to help people preserve their limbs, and plus an acute patient issue. So, Brittany, again, thank you for being on the show, above and beyond the call of duty. Thank you for taking my job now, but give us a 2-minute wrap up of what we expect for our patient.
Yes, she's actively diving as we speak. She's up there in the chamber right now doing excellent, and she will continue to dive daily today, tomorrow, Sunday, and Monday as we move through this weekend and into next week. And ideally, her limb is saved and her tissue starts to pink up and she doesn't require any further amputation.
How quickly would you potentially see change?
We'll know if hyperbarics in this scenario is benefiting her within the first probably 72 hours. So that's why these 3 days are really important.
And so if we would have put this off till Tuesday, game over? Game over.
Yeah, you have to get it earlier. No, it will not reverse black necrotic tissue. It will reverse pink or purplish ischemic appearing tissue.
Fantastic. And Kym, this is why we do this show. This is why we're thankful for Reflow Medical for defibrillating us and keeping us alive again for at least another year or so. And looking forward to...
This is such a great example of why I'm really so thankful to Reflow Medical for giving us another year, because this provides an opportunity. I can't tell you how many hospitals would never do or don't have the ability to do what you are doing. You guys can't be the exception to the rule in terms of being short-staffed, especially after COVID. And, every person there is literally overworked. And so the fact that you're still willing to go the extra mile for every single individual patient, a patient is a person, they're a human being. And the fact that you're taking an individual approach to care, and each one of your colleagues is literally taking each patient as if they were their own member of their own family, and really customizing the care to their personal needs, and again, going the extra mile. So kudos to you guys. And that doesn't even say enough, because you're not doing it for the glory. You're not doing it for the money. You're doing it straight from the bottom of your heart. And that means the world to us. And if we can inspire other physicians and clinicians to do the same, I just think that that would be amazing because we would save so many more limbs until we can get a handle on PAD. I think that this is really what it's going to take to save life and limb.
Yeah, two things real quick. We have to thank Ohio Health and the Heart and Vascular team at Riverside Methodist Hospital here in Columbus for pulling this together. So it's more than just, it's not me at all. It's more than, but it's Brittany, but it's more than just Brittany. So it takes a village to help these folks. And don't forget, there's 230 million people that have PAD and worldwide, and about 7 or 8 million have critical limb ischemia worldwide. So that's a lot of people that we need to help. And thank you for putting the Global PAD Association together, Kym. And again, thanks to Reflow Medical.
Yeah, a huge thank you. And I know I teased at the beginning of the show, we were going to talk about my tour. They hosted me this week. And what I appreciated about them hosting me this week down at their facility is that they respected me. They took me on the physician tour where they were truly giving me the nuts and bolts of the technology, the mechanism of action. And what I appreciated the most was the heart of every single individual on their team. And I really do want to take some time. I don't want to rush in to share it with you. So we do have the CEO of Reflow Medical that is scheduled to come on the show on September 28th. So you don't want to miss that. And we will continue this story then, because you have to hear about their game-changing technology that I got to experience at their facility. Thank you so much to Reflow Medical. Thank you, Brittany. Thank you, everyone, for tuning in. And this is the start of season 3, so continue to join us every weekend.
Thanks, Brittany.
I think we are clear.
Okay, good.
No, that was amazing. Can you connect us via text so we can get her into some more trouble?
Sure. I will certainly. I'll send it right now.
Okay. Is that
you'll delete my contact and then just slide her in? Is that how this is going to go?
Now, hold on, Dr. John. When you drive home today, don't think we've all just pushed you right out the door.
Right, exactly. But I'll make sure I wear my seatbelt. I'll make sure I wear my seatbelt.
We haven't done that just because you're not the quarterback coach. You're the wide receiver coach.
That's right. That's right. All right. I got you, Douglas.
Receiver today. Wow. No, you're not slipping away that easily. We love you. But I think the addition, I'm wondering if an actual turn, if Brittany's up for it, an actual turn might be, and maybe John, you could do the quick filming for her. It would be letting her as a nurse practitioner do a case in learnings. This would be the perfect one if we could get it into a nutshell to say, hi, I'm Brittany, nurse practitioner at Ohio Health. With this week's The Pulse. This is a case where we have a patient that comes in, it's ahead of a holiday weekend, and this is what happened. This is how the biggest lesson is that by Tuesday after the holiday weekend, this patient's going to lose their limb if we waited. And we got our team together. This was a lesson that is for all to learn, that we were able to go against the grain, order this hyperbaric, called in the volunteers, or not the volunteers, the team for the hyperbaric chamber to do this. And, so I think that this is what it means to go the extra mile for the patient and do what's necessary, right? And then just leave it at that. So that could be a really good little 60-second chunk that we could do for next week if Brittany, you're willing.
Of course.
Yep.
I'm happy to record it if you felt comfortable doing it right now, or if you want to kind of wait and put it together.
I think it'd be nice if we could give an update. So we'll know by Monday.
Marsha said she wants an outcome.
We're here this whole weekend too. So we're here tomorrow and Monday too. So we'll get it for you. That's awesome. Because I hope this works. I really do. So.
Yeah, but this just means you guys are you're here the whole week. There was one doctor that said she won't see any patients on a Friday before a holiday weekend because she doesn't want to have to come in over the weekend.
Well, but so there is
we call it the dump, the dump before the holiday. And basically, for whatever reason, I mean, you can read the tea leaves, but a lot of hospitals open the floodgates and try to get their patients away for holiday weekend. And coverage is an issue, but I mean, let's be honest, people don't necessarily want to work on the weekends. And again, like I said, these guys typically leave by noon. It's 3:15 or whatever it is. And I don't, do you have to stay here the whole time?
Yeah, I can't leave it.
Well, we can die for tomorrow morning.
Yeah, but
right.
We'll just do whatever the other staff can.
Yes. So, I mean, again, this.
But can I share one thing? Like when you took that oath, Dr. John, I mean, I'm a recovering addict. So I'm a licensed chemical dependency counselor here in the state of Texas. So I took a call at 3:00 this morning, and me and another individual took a suicide call for a recovering addict. And it's that thought that I know as a recovering addict, the only way for me to get what I have is to give back. And what you go through as a doctor, and how do you develop that heart that no matter what it takes, I know I need to be with my family, but this patient needs me right now more than anything else. And to develop that thought and that feeling that that's what it takes sometimes, isn't it?
Well, I mean, I always tell this to the interns, medical students, that being a physician, being a provider, physician, nurse practitioner, PA, there is a lot of responsibility with that, and you have to take it seriously. But make no mistake, I mean, like, this is a job. There are days when you don't want to get out of bed. There are days where you want to do other things, but people are counting on you. And like I've said too numerous times about this show, listening to people's stories, listening to the Save My Piggies, listening to you guys talk, you develop more empathy as to what that patient's going through. And I think that, at least personally for me, has made me a better physician. I'm not always like on my A game, and maybe not the most cheerful guy out there, or the most positive sometimes, because this can drag you down. I mean, like, there's a lot of critical care doctors that I know through COVID who they could not handle the amount of death that they saw through COVID and have quit. So it takes a toll on everybody. But at the end of the day, remember why you're here, relieve suffering if you can, do the best you can. We all make mistakes, but no one's going to fault you for doing the right thing, what you think is the right thing. And this is the right thing. What Brittany's doing is the right thing. And I honestly don't know if anybody else, I mean, I can't speculate, but it just goes without saying, it's the right thing to do. And
you know how many people in our group I don't know how to understand or get them to understand what Kym goes through 24 hours a day, 7 days a week, 365 days a year. Her life literally revolves around each and every one of us as patients. She answers the phone. She still has her life, but she talked to a doctor in Timbuktu at 4:00 in the morning. She literally, I mean, what she goes through is just amazing. And trying to get people to understand that,
No, it's so funny. Douglas gets it because he's there with me a lot. And actually, Marcia ends up on the phone with me a lot in the middle of, all my crises. And it's so funny. And I don't know how you guys experience, a lot of what you do, with your patients, if you see it, but I get a lot of people who really take me for granted, and because I'm on social media, and you're eating a amputation sucks sucker. I can tell. That's my amputation sucks sucker. But yeah, I just, social media is just a mean place sometimes. Mm-hmm. That you should see the messages that I get sometimes with people that, if I'm too direct or whatever, they realize, like, I have 12,000 patients that I'm dealing with. I can't always sugarcoat things, or, people will post things in the group that are.
But, the other thing too is this patient, she probably, I'm speculating, her daughter is a nurse practitioner.
her daughter is a huge advocate for her. I venture to guess she would have lost her leg before this, my hunch, if her daughter didn't advocate. And that's why we always tell patients, I do it, and I imagine, we'll see, Brittany sees a lot of patients for us and knows that we get second opinions, third opinions, whatever. But we've always advocated for patients to have a family member with them, get a second opinion. Don't take major amputation as an answer unless it can be 100% avoided, if possible.
And realize this Wednesday, Kym's going to be on the radio and the show, and it's her birthday. She's not going to be on the beach with a frozen margarita or nothing. She's going to be giving to us on her birthday, which is September the 4th.
Happy birthday.
Thank
Dr.
you.
John and Brittany, would this patient almost certainly have lost their limb, leg, foot, I don't know, without the kind of dedication that you provided?
Well, so I'll make my comment and then I'll let Brittany comment. This patient had kind of these smoldering wounds for a while that just weren't really healing. If you look at pictures of her foot back in June, it actually didn't look that bad, but I think the bone was infected, and her daughter just felt like things weren't getting better. And so I did a procedure to get some better blood flow. The thing we often worry about is what we call embolization, so debris within the vessel breaking off and clogging up, the little tiny micro vessels that you can't see. I don't believe that happened, but she did have some complications. That she's got a bad heart, bad kidneys. I mean, there's a reason, unfortunately, why if you look at all comers in her situation, particularly those with bad kidneys and close to dialysis, probably 40% of them are dead in 3 years. It's bad. And I always talk about being proactive, and, the horse is out of the barn here, and we do what we can. I hope to God we can save her leg, because if she loses her leg, there's 50% of people who get a major amputation are dead within a year. 10 to 15% die in the hospital. They don't leave the hospital. So a major amputation for her is tantamount to a death sentence. So Brittany's doing everything she can. I don't think she needs any more blood flow, because I think there was decent blood flow. It's just
infection.
Well, there's infection, I think, but it's just the micro tissue doesn't work.
Well, you guys have me close to tears, so I just want to say on her behalf, thank you. Because if that were me, I would wish there was a team like you guys working behind the scenes.
I think, is this Douglas? Is that who that is? I think something that I thought of when you were talking, Douglas, and just kind of goes with all of this, when you were asking, like, with your role as an addiction specialist and being a recovering addict yourself, I think you'd agree, similar to our role, you have to have a calling. Like, you have to have a calling to want to do this kind of work. And how do you prioritize family over work, or the patients that need you beyond just, I didn't take the Hippocratic Oath, but I feel the exact same: do no harm, help people, don't hurt them. And I have a young daughters at home that are, quote, need me, but my calling is here, my passion is here. And just like that woman laying in that bed, if that was my mother or anybody, I would want someone like you said, to offer the same thing to them. And it's not often that we have to be faced with these dire emergent situations, but when we do, and we are able to help someone in a big demonstrative way, it feels good for us, but more importantly for them.
And we need that follow-up for sure, because I think everyone's going to hear this show is absolutely engaged in the story now, 100%. And we really do need that follow-up.
Yeah, because I feel that part of me wonders if I should have done anything to get her blood flow. But the issue is she had no, we call it named vessels. She had no named vessels going into her foot. God gives you 3 arteries that supply the foot below the knee, and she had none of them straight line going in. And I felt like she needed that, and I would do it again and again and again and again. And I hope that this works. I mean, I think she was destined for amputation of some sort, but again, what we do, we make errors of omission or commission. So we either make an error by not doing something, or we make an error by doing something. Early on in my career, I felt like I would make errors by not doing something, and now I make more errors by doing something, like what I shared with that one case. But
at the end of the day, if it's my dad, mom, friend, whatever, what would I do? And I would have done that procedure on her over and over again if I had to.
Dr. John, when you said that she had no named arteries and that we have 3 arteries, is that what, when we're looking at our Dopplers and it says multiphasic? So are they talking about the 3 arteries?
No, so you're basically kind of looking at like volume kind of through a tube, and then that volume kind of gives off a certain pressure kind of calculation based on the ultrasound. So the phasicity means that the artery is kind of healthy, and it kind of it contracts and relaxes. So you want the phasicity, like we'll say like monophasic, meaning it's very slow and just doesn't have that that squeeze that it needs. And then the alternate of that, or the best, is what's called triphasic. So it's just up and down and through. So that's what we're looking at. But when the tibial vessels are the ones that kind of branch off below the knee, and those are the ones that go into the foot that we try to open up most of the time.
Thanks, because I thought that meant 3 vessels, not that you could have multi-phases in one vessel.
Yeah.
Okay,
we sometimes talk about multi-segmental disease. We kind of break things up above the growing, below the growing, above the knee, but no below the knee. And if there's most people, probably 40% of people with critical limb ischemia have multi-level or multi-segmental disease in their arteries too.
I think I'm about ready to take my medical board test. I'm kidding.
You said that, I was like, what is she going to ask?
Yeah.
And here's a good question, Dr. John, that I heard from the other day in one of the groups is, I wonder if the doctors ever think about us when they're not. How hard is it to walk out of that hospital today and leave what you've been through behind and not have that carry you over? So this afternoon, you're barbecuing hamburgers and you're thinking about this lady and you burn a hamburger because your mind, you know what I'm saying?
Yeah. I mean, I'll say this. There are certain physicians who are excellent physicians, dedicated to their patients, but they do they do shift work. ER, for example, you're on, you're off. You're never going to hear about those patients again. Anesthesiology, for the most part, some of the inpatient services, hospitalists, they are on and they're off. We're always kind of on call to some degree, but we have a pretty good kind of buffer. But yeah, you're thinking about the patients. What you think about more are the ones where you have made a mistake or the outcome wasn't what you wanted, and then that can affect you. I kind of liken it to kicking field goals. So you make all your extra points, meaning you're successful in your procedures, kind of the easiest procedures, and then you start trying to hit some 40-yarders. You make those. Okay, now I'm going to hit a 50-yarder. Ooh, hit the 50, 60, 65. Now you're making a lot of 65s, and you feel pretty good about yourself, meaning successful procedures. And then all of a sudden you miss one, and okay, maybe I pushed that one too far. I made an error of commission, and then you miss another one and there's a complication. Now you kind of can fall back, and then you can start missing extra points, if you know what I mean. And that's where it can get in your headspace, and you can get a little bit, I mean, they call it the yips in football, but you can get the yips in what we do. So you have to be, I speak of like having a humble confidence. You have to be confident in yourself, but you have to know your limits, and again, do no harm. But you always carry that stuff with you. Some docs are better at it than others with divorcing themselves completely.
And I think Marcia said it one time. She said she was married to her doctor.
He told me that.
Yeah,
he basically told me that we were in a long-term relationship, and of course, I didn't know we were in a long-term relationship.
Well, again,
I'm glad I like him.
Yeah, that speaks to the fact that you have to, as a patient, have to buy in too. You have to buy into hyperbarics. You have to buy in to stop, quit smoking, or just God helps those who help themselves. You're not going to help yourself. I'll still help you, but at some point, there's stuff I can't do, honestly.
Do you find that you're more engaged with patients that do take a lead in their own healthcare and follow your advice?
I don't know that I'd be more engaged per se. It feels rewarding. Like personally, if I can speak selfishly for a moment, like if I talk to a patient 1 year and I say, you've got to lose weight. You just had a heart attack. The best thing you can do, the risk factors you can modify are X, Y, Z. And then in 1 year, they come back to see us again in follow up and they say, I lost 50 pounds. I don't smoke cigarettes anymore. To hear that, you're like, oh, I'm getting through. You took that initiative, you listened, and that is rewarding. I think actually maybe the opposite is a little more true. The patients that require more coaching, that require more hard conversations, that aren't necessarily following through, or that require closer follow-up because they are slipping or they're having more complications for whatever reason, those people tend to take more of my focus and engagement because then I'm, really trying to like guide them along the right path. So I think it's kind of both ways, I'd say.
What's that saying? Squeaky wheel.
That's right. That's right.
I couldn't walk to my mailbox, but 6 months later, now I'm walking to the end of the road because of what, and it's like, we hear that all the time in this program is, they come join us and they say, well, I can't even walk to the driveway. Now they're doing 2 miles a day, or like, what, it's fabulous seeing Marsha's pictures in the morning when she's doing her hikes. And that's the inspiration. That's the giving back that we have to give to each other. And that's why this show with Dr. Phillips and Kym doing their thing is just amazing because it helps the whole team effort. For me, that's the whole team effort that we have to work together. One doesn't work completely without the other one. It is a team. You can't take the tires off the car and drive the car.
I'm sorry, John. See, you're stuck.
Yeah, I know. I tell you, the show, again, like I've said, it allows me to put the glasses on and see through the eyes of our patients, which has been humbling for sure, because a lot of it, like I've talked about this too, a lot of times, you see it as I got to do this to get to the next one and the next one, but like it's a hamster wheel. You never get off the wheel, but that's not a bad thing. Or it's a marathon that you never finish. Like there's no end game here unless you quit. So we don't quit. We keep going. There are good days and bad days. I'm not going to lie to you, but you got to keep going. Lisa,
we've been on the phone with Kym, and she says the same thing. It's amazing what she does for us as clients and what she's given and what she goes through every day. So Kym, 3 years. Imagine 3 years ago and where you are today. Think of what you've been through in the ups, the downs, the backwards, the forwards, 3 steps forward, 2 steps back, 6 steps forward, everything that you go through to what you have given us today and what you've created.
And we have 5 years. The Way to My Heart is 5 years old on Wednesday. So it just happened to be on my birthday. That we got incorporated.
At least you'll never forget.
How that happened. But we're 5 years old. And I didn't even plan like a birthday celebration for The Way to My Heart, which is really sad because you can't do the next big one until it's like, ooh, yay, you're 6 years old. So I didn't plan one for being 5 years old this year because we're so dedicated and so literally, focused on the patients that I didn't even know what year it was. Like, no joke. I had no idea it's been 5 years already until actually, I think it was Marsha Burr, one of our other patients, actually, the one that does our moving Mondays, said, do you realize like you're 5 years old? We should do something. And I said, I don't have time. I am so focused on literally saving life and limb.
Well, yeah.
What's it like being 35?
25. Aren't you supposed to say 25, right, Brittany? You're supposed to say 25.
Yeah, because my birthday was yesterday, and someone said,
"Your birthday was yesterday."
Being 22.
Oh, happy birthday!
That's what I said.
Right. Happy birthday!
Oh, I didn't catch that up. Jeez. See, I don't celebrate birthdays anymore. Like, it's another trip around the sun. You made it. Move on.
I still like to celebrate.
Because my daughter was like, I have to go to school on my birthday. I said, yes.
If they put candles on my birthday cake, I'll have to call the fire department because of how old I am now.
Yeah, that's a good thing, though, right? Well, we appreciate you guys. We really do. Thanks for
being a part of this. This was so special. Thank you.
Yeah, I have one other special treat. So just today, I don't know, John, you were there for Amputation Nation. It's a brand new documentary, Brittany, that they're going to be doing. They interviewed. I'm so glad that John took the time out to come out to our patient event in Chicago. And also a big part of that was so that I could get him filmed for this new documentary. And I got the first clip that we're going to start putting out there, and we're adding it to our show as a commercial during our shows. And so I wanted to show you the first clip because I didn't expect it to even come out this good.
So these are the same people that put together
the radiation.
What's it called? What is it? Scattered. So it was a PBS special, right? Or something?
Or is this went on PBS.
But they're trying to pitch this one to PBS, aren't they? That's what
and they're doing it in separate sections, and I didn't know they're going to be doing a full episode on what we do. And so, but I wanted to show you the first one, and since Brittany is there before you go, I just thought you'd think it was so powerful because it just sums up, what you were saying, that, it's so important. These patients really want to keep their legs. So let me just share it. It's only a minute long. I just need to pull it up really quick.
If you Google static, or no, scatter, sorry. You'll never want to walk in a cath lab again. Because, yeah, well, about like radiation exposure. And
only long, so.
And like,
here we go.
Orthopedic injury things.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just step
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Would that just
That's cool.
Amazing. So that's the first of, they're doing a slow, I know, right? Nancy, it is. Wow. A slow rollout. Douglas was actually interviewed for it as well, as so many others that came to our event.
Can I say this? I was the second person Dr. Walker ever used that on when he first got it.
Oh,
the thing.
Oh yeah, it kind of shows perfusion.
Yeah,
I think what that was. Yeah.
Awesome.
Cool. That's awesome.
I am really excited about our year to come, and we have a new fill-in guest co-host. So when you're not actually, you know what, we can line her up already. You said you can't be.
I'm just the middleman now. So maybe I'll be the agent. That's it.
I think it would be on the 14th. I am going to be. We're announcing limb preservation excellence for Canada.
Oh.
So we're having Dr. Giuseppe. That's why I'm surprised you're not going to be there.
I will call in. I'm going to be on the Phillips boys golfing. Now I don't know if we're golfing or not, but I will call in.
It's just weird when you can't get good sound, and then we have this new sponsor. So we want to make sure.
I can. If the sound's not good, I will. It's like if the glove doesn't fit, you must quit. So that's O.J. Simpson.
Yeah. just because now since we stream also live on video, it's also, then we only put your phone number up there or your name on the screen, and there's no visual.
Yeah, if I can get on the computer assuming I have Wi-Fi and some availability, I'll be there. I'll keep you posted. No worries.
I don't want to, because it's a really stressful month.
I know it is.
I'm going live every single day. Some days I'm going live, like on every Wednesday, we're going live 3 times in a day.
This is on YouTube, right?
We're doing, live on YouTube because it's important because we want these clean, since they're the Global P.A.D. Impact Awards that we're doing every single day. So we want to make sure it's clean and such. So I would rather know in the
I will let you know. I will let you know as soon as I land wherever I'm landing, which is Thursday. Meaning I'll let you know if I have a signal where I'm at by Thursday. Thursday?
Well, because I need to plan for it.
April. So it's September, Thursday. Wait a second. That's the 12th.
I already got someone on the 21st to fill in.
Oh yeah.
And the reason I did that is just because the guy gave us $15,000.
That's good for him. Let him speak. Give him the talking stick.
Just for the one day. He doesn't want to do it often. I thought it was nice just to.
That's very. Hey, you know what? Yes, exactly.
Something to sponsor the show.
I mean, you put your money in, and yes, you should be able to. It's very similar to the NIL where people donate all this money and they want to hang out with the Buckeye football players. So I get it.
Yep.
I have one suggestion. Only if Brittany's game.
She's a busy young lady, so but I can't speak for her, so I will.
I will. How about I include her in all the show prep for it, and so that we're all ready to go. And if you can't make it and your signal is not going to be great from 2 to 3, then she's prepared to jump in and pinch hit for you.
If she's available, right?
But it's Saturday, 2 to 3. As long as I'm out by 3, wedding at 4.
She's got a wedding at 4, so as long as she's out by 3.
Yep. So that's the 14th. So then we have a backup. See, that works really well, and it allows you to be flexible.
Yep.
She did a great job today. You really have a attitude about sharing and making it at our level, as we're not doctors.
Oh, well, you guys have a good understanding of it too. Multiphasic. Who was that? Sharon saying all those words?
It's Marsha.
Marsha, on it.
Yep.
Yeah.
Thanks to Kym. That's because of Kym.
Well, it's because of me. I missed that.
No, the multiphasic, and that is one of the things that actually drives me nuts. People reading their reports and they don't know.
Right.
I mean, I get that, but
when you explain it, they can understand. But man, sometimes it's true.
I just had one today that sent me, and I'm not a doctor, I'm not a clinician, so I can get away with being like, well, but I know what I'm reading, just from being in the experience, not in depth, but and this patient kept asking me, and it even, I was just like, but what are your symptoms? What are your symptoms? Tell me your symptoms. Like, I'm not going to sit there and put it in your head that you have all these blockages if you're literally just walking 2 to 3 miles a day and you're doing great. Because I've had it where suddenly they're like freaking out because they have blockages, and then they stop walking, afraid they're going to hurt themselves. And I'm like, I just
that's where you get on Dr. Google, and Dr. Google tells us we're going to be dead in 3 to 5 years.
Yeah.
Well, but I'll leave you with this, Douglas. This is my It says, please do not confuse your Google search with my medical degree. There you go.
Yep.
All right. Well, you may have. There you go.
You're on the links.
I'm on the links, and Brittany's got this. This is the slowly pushing me out. I see where this is going. That's okay. I'm fine. It was a good run, Kym. Let's go check on that lady. I'm gonna go check on that lady. Let's go. We're gonna go check on her.
That'd be great. Would love that.
Right.
And then hopefully we want an update at some point. So maybe
we will.
Even if we don't have it, we can actually figure out just a live. We can go live for 30 minutes, with an update at any point. Like we could do it at any time, that works for you guys. We don't have to just do it during the show.
I'm happy to provide an update. I want a positive update, but you know what? We have to provide a real update. Mm-hmm. Yeah. So we'll get you that.
We're literally you have all of our positive energy going around.
Everybody's cheering for her. We're going to go tell her. We can talk to her through it, right?
Oh yeah, you can talk to her.
So we'll go. We're going to go tell her right now. All right. See you guys.
Bye, you guys. Thank you so much to you both. Seriously.
Cheers. Have a great weekend. Stay
Sending
tough.
you guys love.
Sending love. Bye.
Bye. Okay. So I'm looking at I need to get Colin an update here for the show, an updated thing for it. But Joshua, so I just don't know, Josh, if I can't remember on that stream. I'm going to get rid of I'll try it one last time with you. If it goes down, then I'm just going to I hate doing it because it's nothing off your back, but it's more work for me, which sucks, is just doing the live myself. And I don't like doing that anymore. You're making me lazy. Josh. Hello. Not even listening. He's not listening. Okay, because our stream went down, Nancy. That's why we're.
Can you hear me now?
Oh, now I can hear you.
No, I get it.
Because I don't know if it's just because, sending it to you versus just doing it on my computer, which is the source of all the groups, and the source, like I am the source of, even though it's a restream, behind the scenes with the wires or the audio waves or whatever it is, it has to push it to you and then out. And I think it's going back and forth when between my computer, in a sense, I would imagine, and yours, and it has too many areas that it might have to bounce off of.
Sure.
I mean, that kind of makes sense. You would think it would be, it's the stream, but I'm just.
Is that same buffer showing up?
I'm sharing my screen. Are you not seeing it?
I am, but where did we find you found that buffer before you shared it with me last time?
Monitor outgoing. See,
there it goes, right there. And then hover over the buffer size on the right, the blue line going straight up.
So this is the one that's up. So right down up there is where that's my personal page.
Mm-hmm.
And that's the peripheral artery disease community page. And I don't know why they require more buffering, right? Because that means they require more buffering. Correct?
Yeah. So what I'm curious to know is as that buffer rate piles up, the signal stops pushing.
Let's look at the session that had the last one. I don't remember it happening during hers, but it happened during, this was the main one. So it's that, no, see, this one is different. So it's still the peripheral artery disease community that seems to have the problem.
And on the right there, that big long upward tick.
Oh, see, that one's
see, that one is different. That's the one we saw last time.
Yeah, that's the one we saw last time, but this time
so it feels like Facebook is playing whack-a-mole with your stream.
Yeah. So you know what I'm going to do is I'm going to go back to for tomorrow. Let's see if I can edit where it's streamed. Okay, I can. So I'm going to take this one.
Well, hold on. I would hold on. How about you stream? You take over until we see it again. That way we know for certain that we're only changing one thing, right? We're changing the source of the stream. And then if it happens again, then we're for sure that they're playing whack-a-mole with your stream.
Well, I just wish we didn't have to do it in a major event. That's my problem.
100% agree.
So that's why tomorrow, do I really want to risk it? Or do I want to just see if we can make as many safe bets as possible? And if we want to play with this, we could always do it during moving Monday with them. Are you working? I just, on Monday I just didn't want to do, I'm already doing a live stream. No one's going to be watching her on Monday. It's a holiday, but if she wants to do it.
I'll be watching.
I mean, yeah, I'm working. I work every day.
Okay. We could do it during hers. Versus, yeah, I just don't want to do, I put too much heart and soul into this thing. I feel like, at least right now, and you know what also bums me out is that I like the clean look of having your OBS with the push of the stream coming up versus on ours when it comes up, it's like jumping between. I can't have a graphic.
Yeah, we can set OBS up on your machine. It's not terrible.
Yeah, but I have to do it before like 10 o'clock tomorrow morning, and I really just don't have anything.
I get it.
I'm so stressed right now, in case you can't tell. I can't even keep up, and after I got 6 boxes yesterday of those watches, and we have no place to put them.
Yeah, don't laugh, Josh.
And I had to actually start selling them to people. And now I created more work for myself. So I have to go for every single one that is sold, and we sold more than 20. Because now in the next few days, I have to go on top of everything else. I have to go and individually ship every single one of those. So I'm thinking I don't have anything to lose by taking it off of the other peripheral artery disease one for right now. Seeing if that helps. I can take it off my own personal page if we want it, but I don't think that's the problem. So I'll take it off of one Facebook page and see if that helps. I won't push it in the groups.
I Googled the word whack-a-mole. I was wondering what the word whack-a-mole meant.
Oh, that old game whack-a-mole?
Yeah.
Yeah. So Kym's been having weird trouble just with Facebook it makes me feel like there's somebody at Facebook who's just assigned to mess with Kym.
Yeah, that's what I think too. And I even pay them $12 a month to have an official page.
Like, what are they doing to you?
Weirdness.
So yeah, they're literally they're screwing with our streams. So we've had now 2 or 3 streams that have gone down mid because of Facebook.
And there's no one to call. That's the unfortunate part about this. There's no one to call to say, "Hey, can you help me fix this so it doesn't happen?" Well, you're an Emil. Won't you call Mark? Won't you get hold of Mark Zuckerberg and tell him who you are, and see if he can actually fix this for you?
You're cute. The only thing is also, Josh, if when we do the streams, right? I know you want to, get up early, but the only thing is when I go back again and I watch the streams, it's like I'm wading through 20 to 30 seconds of nothing.
Yep.
Waiting for something to come up. And I know you don't want to cut it too close, but I would rather not have 10 seconds of just nothing before a video starts.
I mean, I can say go as soon as we have an excellent connection. I just feel like that's rolling the dice.
Waiting like on this show, it just seems like it's
Oh, on Saturdays, I start the stream a minute before he starts the countdown.
I know that's just a long time.
Are you so like Monday with the Marcia and Wednesday? Y'all having the same problem, or is it just Saturdays?
We've only had a couple of them happen. We've only had it a couple times. It's just recently. And it's also, we also moved to where I'm not pushing the stream. It's over on his side, and it might just be too many. So behind the scenes, I covered IT for a while, CIO network, and this is the extent to my knowledge, is that there's a bunch of pinging that goes around. And the whole idea is you want to reduce the amount of pinging that's happening between networks and this and that. And I have a feeling that with Facebook, because it's literally linked to Facebook through my account, maybe here on my computer in my cloud, that it's having to do too many pings to
that makes sense. That makes some sense, yes.
Right. That it does. But then also, this is how I understand it. I'm pulling the call signal in through Zoom, and then I'm pushing through a third party splitter, which is Restream. And so with the key that she provides me, the only signal getting pushed to Restream is mine.
Okay.
Right. And so then it splits out and goes to all of the other Facebook pages and YouTube. Okay. On other events that are not using Restream, I can turn the YouTube channel on and off. With Restream, as soon as you hit go, start streaming, it toggles that for you. Now, if my show fails and OBS is still pushing signal, YouTube is still receiving whatever my cover page is, and I can reconnect my call or what have you, and then re-go and still continue pushing signal to YouTube. But for somehow with Restream, when that buffer blowback hits, it stops sending it across the board, and it also
that's across the whole thing then.
Yeah.
Okay.
Yeah.
See, 10, we had one at 10. I'm on the board at 10. We have one that goes out. We moved it to another day, and it fixed everything. I don't know. We could never explain that, but we just happened to do it, and we never had issues again.
Yeah. So a buffer, though, that's a signal to me that somebody has shut the ingest server gate, right? So signal from Restream is getting pushed into the Facebook, and Facebook has closed that door.
Now,
and so now
we also
happening.
know she had some trouble with Facebook. And are they still limiting her algorithm and all of that because of the trouble that they were trying to cause her to begin with? Remember that?
Yeah, they don't want me to stream to the groups anymore. I think that it's part of it might be just that they don't want people to they really don't want people to stream on they want people to use Facebook to stream. And so we've already lost so many viewers from our group. We've lost so many because we're not streaming. We used to get literally up to 1,200 people, Josh, watching us online live in our groups, and we just don't get them at all anymore. At all. Like they don't even watch this stuff afterwards because we're not streaming live into the group. We would get so much engagement. We're just not getting it on YouTube. So while we're building the audience there, people just are not.
They're allowing you to do this, but if you went to their stream, would it be different?
No, I mean, I'm talking about something different in terms of this, Douglas, that what Josh wants us to do is he wants us to go to YouTube and drive people to go watch a stream on YouTube and then subscribe and then get notified when our streams are live. But our patient base are not doing that. It's too much for them. If it isn't in our feed and flowing through our feed, which is what I was trying to do today, which is hard for me. And maybe it's something, Josh, if we can get you into our group, and then if you wouldn't mind taking it from, what you have to do is you have to take it from our Facebook page on the Way to My Heart, and you can share it into groups you belong to. And when you do that, if you, have the first 30 seconds that you go live before that, and you push the stream, then you can actually end up getting on, or I can maybe, if I remember, we could try this tomorrow, is as soon as you push it, I can get on and catch that notification and push it live into the one group. And then it's streaming from YouTube, right, to Facebook, or from Restream into the groups. But I have to physically share it. I don't know. I could always share the link for YouTube and have it scheduled to go live, but does it actually go live in the group at the time? It just, that became so much. It literally, trying to schedule everything has been hell.
Yeah, you're big month. Yep.
So I don't know. I don't know what the answer is.
So what do you have going tomorrow?
So we have an interview. What time is that interview? 11 a.m.
That's Central?
That would be 1 o'clock your time.
Who's the interview with, Kym?
He's cool. He's an interventional radiologist. He's our interventional radiologist of the year.
Mahmoud Rasavi, MD.
I don't remember seeing a thing for that tomorrow. I'm looking. That's today. I don't remember seeing or getting one for that.
Me neither.
Yeah, I didn't get that one, Kym.
Yeah, I don't know. Yeah, I was trying to just do my best. There were some I don't even know if I added Josh in one. I still have a million more to do. I haven't even gotten all of them done, so I have to get those done. I'm gonna have to jump off because I have to edit the thing today too for the show because it's our sponsor, so I just have to get that done. So I'll just go ahead and edit it, Josh, for this one because I have the Zoom and the only way we can do it, right? So I might as well just do it because I have to do it today. Douglas, you are on it. I did send it to you. Regardless at the weight of my heart.
All right. Well, you know where to find me, Kym.
Thank you. Sorry, I just don't know what's wrong. I don't even know what's wrong with my prompter. I'm a little perplexed here. I don't know why my prompter is not working. It cost me $35 for this stupid remote. It might work now. I finally figured out it's just I think it just they don't tell you how to pair these things, and it says to pair, and then you try to pair. So I think that they're now connected to each other. So I think I can go now to teleprompter here. I mean, it didn't work too bad, did it, with me? I mean, did it look like I was reading?
No, it still doesn't look like you're reading.
Oh, that's good. Use this device as remote. To connect, tap on the button, control this device, and choose use Bluetooth option. I did. It says it's ready to pair, but I already paired it. This is what you get when you do cheap technology. And I still need to get a microphone, and I don't know which microphone to get. I was thinking that maybe it'd be better for me to just get, in a sense, a boom mic, one that comes over so it's above here.
That'll work.
If
so
you're gonna check, I was gonna say, if you're gonna check boom mics, one of the best websites to buy them from is going to be B&H.
Yeah, but they're so freaking expensive. Man,
That's why one of the things you can do, which I've learned some people do, is you look at them, but you don't buy that model. That you find the model you want on there, but you go to your Amazon or your other retailer to see if you can get it at a cheaper rate.
Well, can you tell me which one to get?
Well, for boom mics, you got to give me 2 seconds to look up, but there was one I think would work for you quite well.
Because I can't have it in the shot is the problem.
No, that part I understand. There was one I remember seeing that was was personal and good for desktop setups. I just got to find it real quick. Give me 2 seconds.
You only have 2 seconds, though.
Excuse me. Give me 222 seconds.
1, 2. Oh, never mind. Okay.
Wow, this is taking forever to get this stuff working. Oh my God. Oh, I see Kym's on. Kym decided to join us. Yeah, Kym, it only shows 35 minutes. We had a crash. So we're going to go ahead and we're going to delete that, and we're going to just get another one up today because of our sponsor. I don't want them to see that we crashed on our first day. That just really kind of sucks. That they're going to go online. Huh?
You want me to delete it now?
Yeah, I think I would. Yeah, no, thank you. I might need to delete it though on all the pages, our Facebook and everything, because that just looks so bad. I'm kind of thankful that they didn't join live, or else I would have gotten a call. I don't like those calls.
Do you think it's just you, or do you know of anybody else that has the same issues?
We're the problem with streaming is that everybody uses different stuff.
Okay.
And we have a different situation going on. And because of, and I'm not even happy with how we're doing it now, because Facebook, it's really screwed us over. We're not getting the views on YouTube at all. And we're getting more subscribers. but we're not getting the views on the show at all. Like, it's the least watched of most of the stuff that's out there that we're doing. And I even have it listed as a podcast that people can follow and subscribe to, where we were getting the actual views and the listeners was directly through the group. Everyone was tuning in every Saturday. We had a bunch, remember, we had all kinds of people coming in and into the thing. We would have like, you know, anywhere between 10 and 20 people with every single show.
I do remember,
coming in. And now we have, and we're blessed. I mean, we have a few of you guys that are dedicated, but we don't have anyone anymore. Like, there's hardly any engagement at all for the
so
show.
how would we promote that more? How could we, like Nancy and I and Kym and how could we promote that more if we were to get that out there more?
I mean, it was just easier because it would broadcast and people would look for the stream every Saturday. And they would be able to engage live. I mean, I can try doing it again. It's so much more work for me to have to then, you know, on top of scheduling, and you think it'd be, oh, well, it's just one more, but then there's always one.
But what I'm saying is there a link you can create that we can put out there for you?
The thing is that you have to have a way of doing it. You can't just throw up a link and do it. You have to, and I'll still have to write it for you in order to do that, if that makes sense. Unless you know how to, if you could set it up, Douglas, to where you're on the Way to My Heart's Facebook page. This would be the only way to do it. If you were on, and it would have to be every stream, if you're on our Facebook page, not the group, but the Way to My Heart's Facebook page, and I can actually add you as a content person on there. If you are on the page, and as soon as Josh says, I'm pushing the stream, you'd get a notification. You click on the notification. You have to get out of the thing is, it's hard for me to teach you how to navigate it because I still can't do it 100% every time. I have to fiddle around, but you have to get to a point where it's on the page and you click share, and then it pops up with a few options, and then you click group. So you hit click share, and then it goes in a group, and then it lets you select the groups. But when you do that, you have to also put a message at the top that says, you know, come join us live.
Okay.
You know, watch the stream. If you want to join the in-studio audience, here's that link, or else, you know, feel free to comment below. And then what you do is you could pick the groups and you just say share in the different groups, and it'll have a list of your groups that you can share it in, if that makes sense.
Yeah, it does.
So, but I'm not good at explaining, and so you might have to finagle and figure some of it out on your own, because I have to kind of still figure it every time. But if you want, I'll add you as such and see if you can figure it out, because then you could actually share it in every single group live when we are live, and that would increase the number of people that are watching. Yeah, you know, Kym, the link you have to click through into the description of the event for the link, because Facebook does that deliberately, again, as Josh and I were talking about, that it hides the link. It says you have an external link, and you put the external link in there, and it doesn't show anyone the external link. So I have to put the link in the description for you guys to find.
Yeah.
So annoying.
I did the same thing, Kym. I just typed in Zoom, and it comes up.
It comes up.
Well, why don't we work? I'm willing to work on that. Let's see if we can do that, because I put out a message just to people to get on YouTube and go to our page and read our stuff. I talked to Peter yesterday. He was on there. I said, don't forget to let the commercial play. He said, I'm waiting on that. I said, let the commercial play. Peter from Naples, Florida. Him and I talked yesterday, and he was on the YouTube page.
Yeah, that's cool.
I don't know if this is making sense, but I've been getting on by just going to the events page and getting on that way, because it used to be on there, would come right up on the Facebook page and I could just jump on, and I can't do it anymore.
Exactly. That's the problem. And that's because, number one, and this is the primary reason, that Facebook is not allowing us to go live directly in the group. So we can't, it no longer allows us to stream directly in there. It's eliminated groups.
Is there a way to get a message out to all the members and say, at this time, this is what's going to happen? Because I know Douglas does send things out, and just say, go to the events page and go on to just temporarily till you get it fixed.
We do. It actually, the events go out to notifications. The problem is that, when you have 6,000 people in the group and you have, 30 to 40 posts a day, Facebook is, and the more I'm posting and the more Douglas is posting, people are just ignoring our posts because they just see them all the time.
Yeah.
If they're not strategic posts with the right hashtags and, the right formulation, people are they're tuning them out because there's just too many notifications coming from our group now every day, which is kind of a good thing, but it's a bad thing for our stream. And that's why it was so much better, because usually before, Facebook would prioritize our stream in the group. And then I could actually go in there and I could feature it right then and there. And it was easy. Now what we have to do is we're prioritizing YouTube, and we're not, and because of it, and because we can't depend on Facebook. Facebook did this to Zynga. Do you remember that company Zynga?
Yeah.
That was the video game Farmville. So they built Farmville. Zynga is the company. They built Zynga all around completely Facebook and delivering on the Facebook platform. And then thinking that Facebook, would always be there, but then and also they were hoping that people would jump off of Facebook and go to their own platform and try and do independently. And as soon as Facebook was like, shit, here's a multi-billion-dollar company that is built around Facebook, we're going to do shit ourselves. And so they literally came up with new rules that sent Zynga into a full implosion. And it went down. I mean, in a very bad way, because they could no longer deliver on Facebook in the same way. So that's what Facebook is doing to us, is they don't want us streaming on YouTube, right? They don't want us streaming on YouTube. They want everything going through Facebook. So they want us to stream live using their technology.
Okay.
And I don't know if, maybe Josh can answer this. I don't know if I can have two stream keys, if I can put a stream key through Facebook and let it just automatically go live there, and use the same stream key for, going, through your OBS. But I don't think that's possible. I think Facebook probably has it completely locked down.
Damn Zuckerberg.
Yeah. So, and they're not going to change.
You do bring up a good question, though. In the event that you remove the YouTube port, well, no, because I still need to be able to push to YouTube.
Yeah, we just don't get. We don't get any views on YouTube. like maybe one or two.
So what you're saying, Josh, you think if you don't do YouTube, Facebook may pick up because they think they're on
Oh,
your.
no, 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 no. I don't think that at all.
Okay, okay,
The
okay.
Facebook buffer thing is that's the biggest indication that somehow signal is being stopped processing there and it
Okay,
just
okay.
backflows. But I was going to say
Sorry to
if I
interrupt,
could
Kim. I
push
just
the
need to
signal to
double check
YouTube
something. Do you
individually.
have a microphone at your house right now, or do you need a boom microphone itself? Because I did find a boom mic, but I didn't know if you also had the setup for it already or not, or if you had the microphone itself or not.
I have a bunch of microphones all over the freaking place, but my place is such a disaster. I'm gonna need to clean and go through things. So I just thought it was so much easier. Douglas knows me very well. He saw my suitcase. So I don't know. I think it's just easier to just buy a microphone and set up.
Okay, what is your budget for mic and setup stuff?
It needs to be the best bang, clearest bang for the buck because I have no money.
Okay, so
I
just to
put
give you a
money
heads
in.
up of what I found here, if I were to send it to you, it would be about $60. The company name is Paulson. Paulson does fairly good stuff for what we call like professional hobbyists stuff. So they tend to be good bang for buck, especially if you're just going to go and get what you need to get. You're not going to have too much interference. The only thing about them, which is what I tell people, is if you want to do more professional shots, like if you were to do stuff with movies or video audio stuff at times that's not stagnant, that might have an issue. So our show will be fine. But if you needed to go on the run as if you were a reporter or anything of the sort and get someone right then and there, you may have issues just because it is not the greatest when it comes to the pickup style when it has other elements coming to it. Yes, they do have things to help lower and keep a general good sound to it, but that's the only thing I would say.
Kim, I made a donation yesterday. Use the money.
You are not supposed to make donations. Because then I use it back on you, my friend.
No, you get you a microphone. Use it for the program because we need it for the program so it works right. So go look in there and use it for that.
I know. And Kim, anytime if you need anything like that, let us know. So maybe we can chip in, right, Douglas?
No joke. I mean, we're a part of this too. I mean,
you guys are so cute. So thank you.
So there is some money in there.
Okay, hold on, and thank you so much, Nicholas and Nancy. But so what is that limitation again for it? I mean, I don't like things that have limitations, and I always test their limitations.
So the general idea with the limitation for it is that this will not be something that you run and gun with. So, for example, if you're someone who has a DSLR or you have any kind of movie kind of boom mic and you need to move very quickly or move very fast with it to do it, it's not the type of hardware that's strong like that to keep sound. But if you are going to be stagnant, like you have it in place, whether it's outside or indoor, you keep it generally stationary, it's going to pick up sound quite well. You just need to have it set up to where you want it to be. I've seen Polsons be in action when it comes to still shots or when it comes to like interviews or anything sort, and they work very well. But when it comes to like sweeping shots or when it comes to things that have to do a lot of action, has to pick up things like that, that's when it gets a little wonky because it has to be moved around too much and it doesn't have the, I'm not going to say the girth, but it doesn't have the weight to be able to handle that and still pick up good audio.
So Colin, can I ask you a question?
Go for it.
So if we were to step up one or two from there, so if we were to get a little bit better one for her, that where like if she's out somewhere and is doing the show on a Saturday, you know, what would you suggest then?
There was one I saw. Generally speaking, if you're going just by name standards, you would go Rhodes because Rhodes is always going to be reliable. But I have one in mind that I think you can do. Give me 2 seconds to get the name back up for you real quick.
I've heard this over and over again.
Yeah, Douglas, if you can do anything, I mean, we could all chip in something. And I mean, I'm doing this LP2 thing on their support group, and this thing is exploding because I'm seeing all kinds of people now with peripheral artery disease, and I'm telling them to come to our site. So I'm trying to.
So the one that I'm looking at right now, right, is a road. It's a road one. It's about, the one I said was about 59, call it 60. This one is going to be 99, call it 100, right? So it's a Rode VidMic Go 2H ultra compact analog USB camera mount shotgun microphone. That's the full name of it, but it's basically a Rode shotgun microphone.
So it would be better than the one you were suggesting.
But will it sound hollow or will it sound crisp?
No. When you usually get Rodes, you get them for the audio fidelity. It will sound crisp. It will capture it, and it can capture sounds further than what you were expecting. That's one of the good things.
Because I want to sound radio quality because I have to do all these voiceovers. I can't do any voiceovers right now.
First things first, if you want radio quality with your microphone, that's perfectly fine. This and the Pulsar will be fine. The only thing is the atmosphere. I would say if you're outside with this and you want to still have radio quality, you'll have a little interference here and there because there's just outside there's going to be noises, but the Rodes will keep you clear and the Pulsar will generally keep you fine. Just no one can run into that one. That's the only thing I would say would be the main difference. Also, the Rodes is a little easier to equip to different equipment just because it's a little bit shorter, stockier, while the Pulsar by itself is not fine. It's just a long stick. So if you don't have the equipment to hold it correctly or you don't have it in the right spacing, it's not going to work. But for the Rodes, because it's smaller, it's easier to put on a camera that's DSLR. It's easier to put through your phone if you have a strong enough phone to do it. It's easy enough to put on an actual interview camera or one of the larger cameras that you use at a studio. It's easier to mount onto those things as well.
All right, Kym. So there's another 50 in there. So get what you need to get, Kym.
Douglas, you're not supposed to do
stop.
Can you put a link in here to Amazon, or should I get it off of B&H?
The main thing I'm going to do right now is I'm going to email you the name of it. I can email you the link that I found it, but I'm just going to email you the name, and you can find out where you can get the best bang for buck.
So Kym and Nancy and me, if y'all want, go to the Way to My Heart webpage and donate a little bit. There's another 50 in there, Kym. Get what you need to do this the right way, okay?
Oh my gosh, you didn't have to do that. Douglas Salisbury. I'm going to smack you one.
So I know now there's 100 in there, at least 100. So
Douglas, the Way to My Heart webpage, just go on.
Just go on the Way to My Heart webpage.
And
up in the right corner, it says donate. Right on the front, it says donate. And then you can make a donation there, and it goes straight to Kym.
Okay. All right. Okay. I'll do that when I get off. We got to keep Kym going.
So there's going to be some in there for you, Kym. Do your little bit of your research and get what we can help you get, okay? So that it works better for you and it makes it easier for you, okay?
Well, thank you. You guys are too much.
Did you see what Kym said?
I haven't looked yet. I'm trying to look at the
Yeah, I wish I could get more, but when I get paid Social Security, I can. But I will.
Guys, to do this.
I sold another cross. I got more work now. I don't know how I'm going to do what I'm supposed to do, but you give so much to us, Kym. You always give so much to us. Let us give back to you sometimes.
not a very good receiver. There's our hotline.
No.
Yours ringing? Never.
Douglas, if I have any trouble sending it, I'll message you. I'm not real techie. But I have PayPal.
I think Josh left us.
Nope, I'm listening in. Just waiting for you to give me the clear to go.
Well, I don't have to tell you when to go. I just was going to ask you what you think. I'm waiting for hey, Colin, can you put it in the chat there what it is so Josh can see it too?
No problem.
See which one. Because I was thinking that, I just didn't want to get but I have these blue mics, but the problem with the blue mic is that it's also better if it's up here like this, and I don't want to have anything in my face. So I want it up higher so that it's out of my range here. But if I turn my head, I don't want it to go away.
If you were to still use that blue mic, then I'm going to send it in the chat as well and an email as well. You would probably want a certain mount that can extend. Like, for example, this boom mic mount I saw that extends, it can go between 18 to 36 inches out for the extension for you. So depending on how you angle it, you can have it still out of frame, out of view, but still have it still have it the way you want it to, angled the way you want it to. Also, it's a desk clamp type of mount. So you clamp it to the desk where you want it to, and then you extend from there.
Okay. Did you put it in there? So Josh, trying to look it up on Amazon.
I see it.
What do you think? Wow, they have all price levels for those. Here's the $99 ultra compact.
Yeah, this doesn't look like it comes with the it's just the mountable portion at the bottom of the boom mic. Is that what you're looking at?
Yeah, it's mounted on something, which usually free delivery tomorrow. Oh, it's $10 cheaper if I went to Tuesday. I wouldn't know which mount to get because in the frequently bought things together, it doesn't have the actual desk mount that goes with it. But I also wonder if I should have one that has the little, okay, so there's this. Will that mount into
the second thing he posted is boom arms and table clamps.
Douglas, did you get it? Douglas?
Douglas looks like he dropped off the call.
Okay. All right, Kym, I'm gonna go, okay?
Sounds good. Thank you so much. I appreciate you.
Okay, and hope you get everything straightened out. I'll see you again soon.
Sounds good. We'll be on tomorrow at 11 a.m. Or
Okay.
I guess 2 p.m. your time. So now I'm having problems with this stupid teleprompter. I can't do anything. Hello, Douglas. Hello. Hello. Where are you at, Stephanie? Oh my God, my grandmother literally lived on Robert Toller Drive at the top, right next to Boyd Park.
Josh, from what I'm reading on both the specs, it looks like the Rode mic
let me
itself
turn
will come
off,
with its own shock mount that should
one
be able to attach to the mic arm for the boom mic. I would double check